All right, everybody, it's Dr. Lee with Chronic Health Podcast. This episode, I have the distinct pleasure of welcoming Dr. Curtis Fedorchuk, who is a researcher, clinician, founder of Better Health by Design in Cumming, Georgia. Welcome on, Dr. Curtis.
Well, thank you.
I thought I'd talk to you today because you do a ton of research in chiropractic, and you're also a very busy clinician taking care of patients and a family man. And I thought, it'd be really cool to understand a little bit more how you tick and, really how chiropractic has affected your life and how you're affecting the chiropractic profession and really all your patients and those around us. Because I read a lot of your research and I'm amazed by it and the ability that you have to share with other people. So I want to thank you for that. And also wanted to ask you a little bit more about you. What really brought you into the profession in the beginning? I know you were an athlete, so.
Just very in a nutshell, because I know everyone's got their story, but yes, my chiropractor, he had like 3 chiropractic miracles. My knee, breathing, and like my neck was lodged into my shoulder on Christmas morning, and my chiropractor helped me. And I kind of made a deal with my parents as they were driving me on Christmas morning to the chiropractors. I said, if he helps me today, I'll go to school. Like, I'll do it. I was probably 20. Wow. And sure enough, so he helped me, and we were driving back. It was like -30. My mom looks at me and goes, well, I'm like, well, what? She goes, you going to go to school? I'm like, so I registered, and like 2 weeks later, I started in January for the winter session.
Wow.
So like for like undergrad, but
yeah.
And just, that was pretty much it. And I always and the reality is I always said I wanted to be a chiropractor since I was like 10. And, but then as you start to get older and you realize what it takes, and I was like living the dream, I had my snowmobile, my truck, living at home, had my girlfriend. I was like, what else do I need? You know what I mean?
Yeah.
Had a motorcycle. Yeah. And then you slowly realize your parents don't want you there all the time. So loving. Just kidding.
I have a 20-year-old.
What's that?
I have a 20-year-old.
There you go. You're like just waiting for them to leave. But no, seriously. So I really wanted to do it since I was 10. So I'm living my dream pretty much. There's things in the profession I didn't know about, which is what drove me into research. And I didn't like a lot of it. And then my dad, zero time for sympathies, just as like, we'll do something about it. Like, I don't even want to hear it.
You don't like it? Change it. Wow.
Yeah, pretty much. That was it. He said that to me. And so that's what I've been doing ever since.
Nice.
Trying it.
So you got interested in research while you were in school?
Yes. The big story, which disturbed me to this day for several reasons, personal embarrassment, also sadness for a young girl, is a guy at a church we went to. His name was Scott, a super nice guy, but his job, he was actually a rocket scientist. Like, that was his job at Lockheed Martin. And his daughter had asthma, and I was first quarter, and I was just so excited. Oh my gosh, you got to get her adjusted. I go to Life. You got to get her, and I would like to say, I wasn't over the top with my spizzerectomy. If you've ever heard that, what they say, your enthusiasm for chiropractic. I was just like, very matter of fact, like, have you ever got to adjust it? No. And he just goes, and he just said nice. He goes, Curtis, could you bring me some research on chiropractic and asthma? Oh my gosh, yes, of course. Yes. First thing in the morning. So you can talk to my wife. She knows I'm early for nothing, which is one of the things she loves about me. Right. So no, I'm early for nothing, but I was there early the next day with like a dolly, waiting to wheel out all the research out of the university and the library. And I have it downstairs. I should run down and show you, but essentially they gave me a piece of paper that showed like the lungs and some nerves, and had some blurb about the lungs, and like there was nothing. Essentially, it was a piece of paper. And I was so distraught, and my stomach was sick, and I just looked at them, and I was very polite. I'm like, are you sure? Are you hiding stuff from me? Is there like a vault that I'm not supposed to have it? No, that's it. I'm like, and this is like 1998. The internet's just coming out. But anyways, I was quite sad because 3 things. My profession has no research on asthma, and I'm like 1,800 miles from home with a bride. It's something I want to do forever. There's no research on it. Number 2 is I'm not going to be able to show this guy anything. So I'm embarrassed. And number three, and probably the most important, is that his girl's probably not going to get care because of it. Now, a lot of chiropractors will say, oh, I don't need research. I didn't. And I'll get to that in a second, but I could have got them in. I'm like, well, guess what? You know, you don't have time to run around to get everyone. And if someone wanted, how hard is it to have had that?
Yeah.
So I had a choice of whether or not to ignore him and make him think I forgot, or I had to physically go up and give him this piece of paper. So I thought my integrity was more important than my embarrassment for the profession. So I photocopied the paper, walked up and gave it to them. And I was just shamed. Like, I just remember I was grossed out and by myself. And he just looked at it and he was so polite, and he looked at it and he folded and he put in his pocket and he goes, oh, thank you, Curtis. Thank you so much for that. It's just very genuine, but kind of the same token, like, figured, you know, so this little girl's never going to get care. And so I was like, that sucks. Like, I was so mad. And then kind of started my my pursuit of research. So someone directed me to Dr. Matt McCoy, and I found him at the Roswell Street Clinic in Life there. And so began the journey. And then I got my green card in 2009, and I thought, well, technically I don't have to do research anymore. You know, like, I can be a citizen now. But it stuck with me. And in fact, I've done more since 2009, bigger projects,
Yeah.
and whatnot. So it's been, and we have over 100, we have data for 100 papers.
Wow.
Like, it's not like we're we could do, like, we have titles for 100 papers more.
Yeah.
Right now that all have meaning. Like, some are cases that that are first have never been published in the profession. And others are like actual like large, like thousands of subjects showing the prevalence or the importance of, or symptoms to go with. I mean, I gotta be honest, I got some cool stuff like that is like super important. So it's coming just slowly.
I love seeing that stuff because a lot of this, the majority of this, talks about physiology and function, not just symptom abatement or pain reduction. So,
oh yeah,
I
don't
love
think I
that.
have one paper on. I mean, I do have paper. I shouldn't say that, but do I have a paper that has like a pain in it? Oh, we do, just because it happens. You know what I mean? But it's not like we set out to go, look, neck and back pain better. It's like, no,
Right.
It's usually something like double spondy correction in the low back, spondy correction in the neck. You know, they get better stuff, that just basically what symptoms they had to go along with the correction we had.
And most recently, you're about to have a study published on kids and misalignment or spondylolisthesis in the neck, right?
What the biggest one we just did this is probably you know how you're climbing a mountain, you're supposed to, you know, Dr. Borio talks about pause, turn around and look how far you've come. The biggest thing over the last few years, rewinding a little bit, probably in 2017, Dr. Doug Lightstone and I were at a seminar in Dallas, and Dr. Matt McCoy goes, you know, how many people are subluxated? And everyone goes, everybody. And he goes, really? He goes, how do you know that? He goes, there's not one epidemiology study on the prevalence of subluxation. Not one. Yet it's the cornerstone of public health. So Dr. Doug and I look at each other. Oh, we can do that. You know what I mean? So my entire practice data, which is on posture array, which is a way to mark your x-rays. It measures all the angles, all the millimeters, translations, everything on all views. It measures instability. I had that on every patient. And so we started, basically, I had an intern in my office, not intern, but an associate, downloading all of our data. And the software is not even meant to do that. So we called the programmer, who's a good friend of mine, and they gave us access to this special, basically, type of software they had, so we could extract all this data and put it in usable format. You know, months and months and months of work. And then we had to hire someone to basically organize it. So now we have the largest study in the history of the profession in terms of epidemiology.
Wow.
Just on the cervical spine alone, we have 2,300 people.
Wow.
And so we've been working hard on that. We have 800 on the thoracics and we have 1,800 on the lumbars, but we hit the brakes on that in terms of getting it published, because about 2 years ago, pediatric chiropractic came under attack. And it has been for a while. And we looked at each other and we're like, we have this monstrous project to do, which we should get done, but adult chiropractic is not really under attack, right? Like that, it's like we didn't need to do that immediately. What's another year? So we switched gears to pediatrics, and what we did it on was the prevalence of spondylolisthesis, which is a misalignment going forward and back, which is a subluxation. And of course, the purists will argue, well, it's not really a subluxation. I'm like, well, what really is? Right? I'm kind of jumping all over the place, but I knew there'd be detractors to this study, but we had to get something in the literature that shows misalignments in the neck are bad, right? And so it took 2 years of arguing on this paper, like back and forth between reviewers. They just couldn't believe we x-rayed asymptomatic kids. Why? Yeah. Well, why did you x-ray these kids? Well, because we're screening for subluxation because their parents wanted care, they fell, or they hurt themselves. They had low back pain. Perhaps they fell on their butt playing sports, but we're checking the whole thing. And again, we have to argue with that. And then again, 2 years of going back and forth. Like it just, and some of their comments are just, like you got to wonder, sometimes they don't even read. Like Cervical, you got to be so professional. As per this line right here, this is a response to your question. So June of this year, finally, and they even chose it for the cover. We have a paper published on the prevalence of cervical subluxation. It's actually on the cover. Actually on the cover of the journal. They chose it for the cover of the journal.
It's awesome.
On 342 subjects, I believe, which is sad because it's embarrassing to me because that's only how many children I've seen in my practice, right? Over the last 10 to 12 years. But I've never professed to be like a pediatric guru. And, but it's the only thing out there right now. As I say, it's the largest study and the smallest, right? Because it's the only one. So if someone has anything better, which I'm sure, well, and that's the point, is to be the catalyst for springboard for other things. And so it wasn't a race to be first. It's a primer, and it was awesome. Much needed. So it actually says in the abstract, it says routine x-ray despite symptoms is actually recommended. Wow. And when I told Dr. Lystone, he did an amazing job of writing the paper. He goes, they didn't leave that in there, did they? I go, yeah. And he looks at it, he goes, well, so that the fact that that's in the abstract is huge. Yeah. So it's so kind of funny because then when I have parents come in, I looked at them anyway, and now I'm like, do you know there's studies that show your kids should get checked because there's no symptoms after a fall? And then I literally point to the wall, like all our really important studies we have on posters, and then I'll just point to it, and they're like, holy cow. And they can just tell when you're also saying something with certainty. Like I have a good poker face, but usually it's because I actually have good cards. So that's not a good poker face. Do you know what I mean? I only have a smile if I have good cards. Yeah. But so they just know, oh yeah. So it's what's funny is probably we started seeing more kids since that study. But that's great. What's interesting is my patient came in who's on the cover. The girl who's on the cover, her mom comes in. I go, guess who this is? This is your daughter. After she fell off a horse, she had no symptoms at all. And then we measured her neck and she fell on her head, and she had like stair step in the upper cervical spine, and instability to boot, which is again a reason not to adjust that area because it's already hypermobile. So it's not just about prevalence of subluxation, it's about clinical indication and need.
Knowing how to take care of it.
Yeah, exactly. So, this is not the time to be cavitating your neck, even though we do that hundreds of times a day. This is not that child that you want to do that. So anyway, so then we proceed.
Think of how many times our kids have fallen, or bicycle accidents, football, sports, hockey, right? You're a hockey guy. I mean, think of all the little big injuries that have happened to the neck that they just get up and dust it off and move on. You don't have to have a symptom to have a problem. And that's what this study shows.
That's the whole point of that. Because in Canada, there's a lawsuit going on right now, just even against adjusting kids. And of course, x-raying them is, you might as well just be the devil, right? So we sent this off to the attorneys. Like, there you go. Here it is in a radiology journal, PubMed, indexed on the cover, showing that kids should be x-rayed even if they're asymptomatic.
Yeah. And this published in June, right?
June of this year. Yeah. Yeah.
Well, I'll try to link that in the podcast notes as well, if we can.
And it is like for one of the it's of the it's even percentages. So of 342 subjects, I believe 70 had spondies over 2 millimeters. Now that was published in a journal probably 2-3 years ago, showing the 2 millimeters in the adult spine is significant,
Right.
not the believed just 3.5. And so in children, that's even
Huge.
just as a percentage, that's huge. So it was like 70 out of 342, and then around 60% of those had no symptoms.
Right.
So just again, highlighting the need for care and
Yeah.
proper management. It's not just, hey,
Let's adjust.
you know,
Get the
just
right
kids.
person.
It's like get the right care. So we mentioned that.
So
But
I
yeah,
tell you,
definitely
everybody needs a
proud of that.
chiropractor, but you also need a great one. So
Yeah, and again, like that is we always say get properly assessed. It always says that. Get properly assessed.
So just for the lay listener here, spondy, by your definition, spondylolisthesis, how would you say that for the person that doesn't know really a lot about chiropractic or radiology or anything like that?
Oh wait, is this for lay people or is this for?
It's mostly for anybody, but yeah.
Better edit out the beginning about the asthma research. Just cut
That's okay.
that. So what that is where the vertebrae has enough trauma, either immediate or over time, where there's enough stress on it that actually starts sliding off backwards or forwards to the extent that it puts pressure on nerves. Now, again, if we're talking to patients and stuff like that, there's research that shows that small amounts of pressure on nerves is enough to actually have them not function properly over time. And thus, so leaving these vertebrae out of alignment like that can be detrimental to anyone. To what extent affects everyone differently. I always get when I spoke in Florida and Palm Beach 2 weeks ago, and I just asked, I go, what's the literature say? They say a weight of a dime. I go, right, the weight of a dime can put pressure on nerves. And I go, so yeah, if a weight of a dime is enough to do it, I go, how about when you have actual slippage of the vertebrae itself,
Right.
like narrowing the spinal canal?
It's like an anvil.
So what's that?
Like an anvil.
Yeah. I mean, to the lesser extent, I always tell people, it's probably the worst part of like my recommendation to people is I don't try to sell the scarier part of it. I'm just like, what's the benefits? I say to my son, I go, stack the deck in your favor, do good things. Don't do things because you're nervous. Do things because you want to have better outcomes. So take care of your spine because you want to be healthy. Work out because you want to be healthier. Eat well because you want to be healthier. Take care of your neck because you want to be healthier. Stuff like that, as opposed to you better do this or else.
Yeah. Agreed. And what would you say about the word subluxation? I talk about that a lot in this podcast and over time, but if somebody just jumped on this episode and didn't really know what subluxation is, what would you say to them from your perspective?
More abnormal biomechanics causes some neurological insult, to if we're talking to a layperson, just you go back to the regular definition where it interferes with the transmission of mental impulses. But it's literally that. It's even if you have, like, I'll use the funny bone, for example, if you have enough pressure on your funny bone, even if it's ever so slight, after a while, you get numbness in your fingers.
Yeah,
now imagine if that same amount of small pressure is going to a nerve to, say, your bladder or your leg or your lungs or something like that. Slowly things start to change. So for me, again, I talk about the easiest is to talk about the front and back of the spine. And again, if this is for patients, is that front to back, everyone knows your spine should be what? It should be straight, right? So if it's deviated, no one says that's normal, right? It's not normal. And so depending on how much it's tethering the nerves, because if it slides to one side, it doesn't just put pressure on the side it's sliding to, it actually tethers the side of the other. So, and there's actually research on that, because nerves, in order for them to function, they have to shrink and swell in order for the nerve to fire. So if your head's shifted way over, actually, a lot of the times they have problems on this side.
Yeah.
As opposed to, everyone thinks compression. It's tethering. Tethering is probably, in my opinion, just with my own injuries, I would say that's more of a problem than compression. Compression comes after the fact, I would think, because when you apply extra pressure on one side, it takes a while for those bone spurs to start forming where you get side on the compression. Whereas immediately when you shift over, the tethering right here, that is immediate, right? So I would say, yeah, that's the most important thing. So it's basically where you're out of alignment, either from the side, like the side view, or from the front to back. And it can be global, or it can be, if it's segmental, it's usually it's some like trauma related. It's not usually like one bone. It's usually like a region.
Right. And it affects the spinal cord too. If it's tethering, you're shifting the spine.
Oh yeah. There's research that just came out, always totally eclipsing anything we do. It's kind of hard to keep up. Dr. Deed Harrison and his affiliation with the PhD researchers out of Cairo, Egypt, they just studied a paper on there's a linear relationship between loss of curve in the cervical spine and spinal cord velocity in asymptomatic patients, thus proving what we've been saying for years, is that the more lined up you are, the healthier your nervous system is.
Yeah.
So, I mean, that's kind of a mic drop on that one.
Right.
What our paper is showing recently is the prevalence of, how many people have that. Sure, that's bad, but then people are like, well, that ain't me, right? Well, or my kid. Well, you don't know unless you get checked.
Right.
So that's why these studies are needed on the prevalence.
Right. What would you say is your most proud outcome, either research or clinical, to date? Have you had one thing stick out in your mind? I'm sure this
probably watching blood sugar drop instantaneously on multiple type 1 diabetic patients.
Yeah.
And how would I know that? Because we have continuous glucose monitors hooked up to them, which measure blood sugar every 5 minutes. Probably that is my proudest because it's monitored in real time. I've had people grow muscles back, like from foot drop, discs reabsorb, spondies, hearing come back multiple times, multiple hearing patients, which is pretty cool. Probably the most is the type 1 diabetes, because again, seeing that in real time and it happening almost every time, it's pretty exciting.
You did a paper on this though, right? We talked about
we did.
A couple years ago.
We published a paper on that, but we also have a series on that. So the paper was just, again, it's just a primer.
Right.
What I was hoping is that, and again, I know this is for the public, so I'll keep the dirty laundry on the profession to a minimum, but I'm just wondering why the colleges just don't, you can add this out. I don't know why the colleges don't take up the charge on that. I just don't understand.
I guess they're in the political,
but they have research. There's people on payroll there for research.
Yeah.
And I'm
I did some studies at Palmer when I was a student. I worked at the research center, and it was all low back pain and, stuff that we were just talking about. That's kind of, we already know that stuff. Let's get to the good stuff.
Oh,
like
yeah.
we're talking about.
Yeah. And all this people that go through you have them there. They're a captive audience, so to speak. The stuff that can be done is just unbelievable. So whenever there's emails that go out from certain institutions looking for money for research, my first question is, what research are you going to be doing? Yeah. And no one ever gets back to me.
Right.
Can't imagine why.
So this type 1 diabetes research that you, what was the outcome mostly? You're seeing blood sugar drop.
Oh, amazing. So not just that. So a measure of your blood sugar over a 3-month period is called an A1C.
Yeah.
And so what we did is we took an A1C of this patient, and then we told him, don't change your lifestyle, don't change your diet, don't do nothing. Then for 2 weeks, we monitored his blood sugar. It was all over the place. We have, again, you can just type in my name. Yeah. And then, and it'll come up in the index of chiropractic literature, and it'll come up on Google Scholar. And we have 7 PubMed papers. So anyway, so we started adjusting this guy, and as we were doing this, we're seeing blood sugar go down like instantaneously. I asked the guy, a patient of mine who is a Dexcom rep, I said, hey, what kind of percentage changes do people just normally get from using this thing? He goes, oh, it's amazing. It's like 0.5% in 6 months and like 1% in like a year. I'm like, oh, well, in a little over 10 weeks, we changed their A1C like 2%, and he's like, what? I'm like, yeah. And of course, it's not a fish story because it's actually on Dexcom has a software that records everything. Mm-hmm. So you can see it. you can actually see, like, it shows there's little dots. It's every 5 minutes it plots your blood sugar. You can see that the sugars are high, low, high, low. And by the 8th week of care, it shows this guy's blood sugar like way more normal.
And so
right?
you're doing full spine adjusting, or was it specific to the lower thoracic? Or
So what the inclusion criteria for taking this patient on is he had to be subluxated in the thoracic spine.
Mhm.
How did we identify subluxation in the thoracic spine? The lateral view of the thoracic spine should have a roughly 40-degree curve, with the bulk of it being at the top, but in the middle, it should be basically straight. Again, if we're talking to patients here. And it just so happened that this person's spine in the T8, T9 region was actually lordotic, which is backwards. So we had reversed curve in his mid-back. So, by the way, disclaimer, we're not claiming a cure for diabetes by any stretch of imagination. We're just showing that, wow, we don't know the mechanism, but this is dropping blood sugar. And I have texts from a 40-year-old type 1 diabetic who is a diabetes researcher, and we did the exact same things to her, and she was blown away. Blown away. I could show you the text message. I show them everywhere I speak.
Yeah.
She was blown away at how much it was helping. And she actually, it was actually scary for her because she was at 90, and then she'd leave my office and the Dexcom arrows would show double down, which means your sugar's crashing. And she would text me like, what is going on? You know, like, how is this even happening? Right. And she actually quit. And I know why now.
Yeah.
Like, I realize now, because it was so hard for her to manage her because there's 2 drugs you use when you're type 1 diabetic. There's long lasting insulin and they're short. She was just going low all the time. And again, it shows, she texts me whenever she take pictures of her meter, and then she'd send me a text. It's unbelievable. So back to the patient that we used, so we had the A1C that was in the 6s, and after the fact, he was just so grateful because he'd never used a CGM before. And then once he started, we have a 2-year follow-up, a 3-year follow-up. His actually, his A1C is better. So literally life-changing. So
yeah,
again, the mechanism we're finding is that somehow, back to what technique we use. So they had to be subluxated. Now, full spine adjusting in of itself is amazing. And that's it's a wonderful service. But what we are trying to do, the inclusion criteria for the other type 1s that we had, is that they had to have an area of the thoracic spine that could be correctable. So what was amazing on this study is not only did we do post x-rays, not only were his symptoms better, not only was he functioning better, but his subluxation in his thoracic spine was actually corrected. So if it wasn't, if it wasn't corrected, it's not that that's not a victory. It's just not a total victory. Because it actually shows we corrected it. And so what we did is we lay these patients on whatever it is they need to correct their spine. So if they have too much curve, we flatten it out. If they have not enough curve, we put curve into it. And we had one young boy, he was at the time, let's see, he's 18 minus 5, he's 13 at the time. I'm like, hey, do you feel the stretch in your back, like right in this region? He goes, no, because we kept looking at his sugar meter and it wasn't going down. And this was probably the most creepiest moment in my career. And nothing was happening. And Dr. Rob Colmer and I looked at each other and we're like, doesn't work on everybody, right? And like the meter was just staying the same. And I'm like, so you don't feel it here at all? He goes, no. So we moved the fulcrum underneath him. I go, do you feel it here now? He goes, yes. We walked away. We came back in 10 minutes and the meter was going down.
Wow.
And this sweat just came over me like this, like you hear about. And same with Dr. Rob. We walked into the back corner by the water fountain and we're just looking at each other, just sweating. And we're just like,
yeah,
what do we do? You know, like, so again, that needs to be explored because clearly it's a way. And I will tell you what's a big thing in the world of type 1 is the management of it not skyrocketing and whatnot.
right.
Better insulin usage, because you can stick yourself with 8, 10, 20 units and may not even get in there for hours, or it's unpredictable. But this became so predictable on these patients. It was unbelievable. So we have to publish this. There you go. I have to publish that series. I have all the data, I have all the numbers. We just need another writer or 5. right?
Well,
Yeah,
that's what I think is probably the biggest challenge. You're in active practice. You have a family.
yeah,
You're living life. You're running a practice. How do you
yeah.
do all the research
Well,
too?
well, you forget. I mean, what pays the bills is I'm a semi-pro athlete, hockey player. Beer league. That's what funds us. My sponsorships for
Right.
being a goalie.
It's awesome.
Anyways, no, yeah. So, but basically, yeah, don't sleep much.
Hmm.
Not recommending that, but
Right. That's how you get
I
it done, huh?
I watch a lot of stuff. I look at a lot of busy people, like even Dr. Borio, probably in yourself, is that you want something done, ask busy people to get it done. And but yeah, we see a lot of people in the office, and we do a lot of research. We do outcomes.
Yeah.
Yes, I have a family, 2 kids and a missus, and I do I do play hockey, obviously, just to keep myself, active and whatnot. But that is done at night. It's usually like 10 o'clock at night, so I don't miss family time.
Yeah.
But sometimes you get home at like 1 a.m. But whatever. No,
Really
legit,
don't
like you
sleep.
do. And so, but then we just get it done because it's necessary. Like that's kind of the motivator. I had one
Yeah.
guy. He's well, again, this is for patients, but he only felt the need to start doing research once he realized it might affect his income. And I'm like, well, that's not really a motivator, is it? I guess it is, but it's the wrong motivator. I mean, I'm not publishing. I don't get paid anything to do
Yeah.
this research. I get some Facebook likes. I had one colleague, they really didn't do anything to be on the paper, but they were sad that they weren't. But they were sad for the wrong reasons. Like when we got Facebook likes, that they were sad they did. I'm like, so you think that our end game
It's
is,
Facebook.
is the Facebook likes? I go, well, obviously it's podcast interviews like this. This is why we do it. I mean, let's be honest. I can rest now, right? Just
Yeah,
kidding.
you made the big time.
No,
Oh,
what gives
listeners.
what makes me happy is the fact that you actually care.
Yeah.
Like that's the juice. Is that I know that there's guys like you, they're gonna take this and show it to people. That's it. That is the juice. Hey, I used your research. Hey, thank you. Like that's it.
Yeah.
Because then it
And
passes on to other people.
a lot of people don't necessarily need to know the nitty gritty, all the details of the study. They just want to know, hey, somebody's researching this and they see a mechanism between thoracic spine and pancreas and blood
Yeah,
sugar and sympathetic nervous system.
Yeah.
Feel like it's all related. So
Yeah.
helping
People
people
say,
get
how do
well.
I get into research? I'm like, you don't want to, like you can, but you don't. Like it's not a curse, but at the same token, it takes a
Not a
lot of work.
picnic.
Yeah. I mean, and I focus on your practice, help people, let us show you the stuff that's coming out. If you have a great idea, that is awesome, but it is, I don't know if it's a calling. I don't know if it's a curse struck by lightning,
It's a blend
something.
of all
It's a
those
blend
things.
of all that you just kind of want to keep doing it. And again, ultimately, because I'll never forget how I felt when I was in first quarter that there wasn't anything available. And that little girl ultimately didn't get care because of that. And so that's why the first paper I published was on asthma. They had pre and post lung volumes, like they measured her lung volume. So I have that in my office. So for people who don't have good breathing, we measure that. And I just, like I say, I just want people to know, I want practitioners to know so they can tell their patients that we have stuff backing up what we do and it is beneficial when done right.
It's good for you.
Yeah.
What do you see as the trend going on in healthcare right now, outside of pandemic discussion, but like in general health right now, or chiropractic research, future of research? Where do you see things heading, or where do you
Just
want?
total, like my opinion, like totally my
Yeah.
opinion is like just kind of answering that question. I see it, it's very, very polar. Because just like in my practice, my patients are because we have epidemiology studies on my practice patients are usually wrecked, as in tons of arthritis, horrible alignment, heinous
Yeah.
damage, or they're pristine. And it's pretty much equal. And it's actually the inverse bell curve. It's not like this. It's actually the other way. So again, you have a ton of wrecked people and you have a ton of healthy people in between. It's kind of, it's the people so that's kind of where I see it, is a more of a division of healthy versus super sick.
Mhm.
Again, I'm totally my opinion. I mean, if someone doesn't agree with that, yeah, I'm fine. Again, it's just totally my opinion. So I'm more than willing to take care of, in my practice, I always say, if someone adjusts really well, I'm like, oh, I'll take 1,000 of you. We'll take 1,000 of you, and again, we'll accept patients who want to get well, but I'm saying there, you have a healthy minded individual who eats right, exercises, we have open room adjusting. So everyone's pretty much pleasant.
Yeah.
And that is our ideal patient of those type of people. And even if people come to the office and they aren't like that, typically they get like that because just everyone surrounding them is just so happy and good.
And
So
it's on my wall everywhere in my office. It's easier to stay well than to get well. So those are it's wonderful to take care of people that want to be well and they're already on that trend. So
correct. And they're just there for not for you to, you can give me their health coach, if you will.
Yeah.
But more or less, they're just looking for that extra thing. I just say, hey, if you're not doing these other things, this is a mute point as well. So, but also you can do I've had people come in who weigh their raisins and their sunflower seeds and drink distilled water, and they still need care.
Right.
Their life just is that much better after that. So
you can't, eat yourself into alignment with good. Eat well, that'll help it, but it's not going to straighten you out.
Yeah, exactly. They sleep, they get their 12 hours of sleep a day and they're still wrecked. I'm like, you need other things. So that's my take on that. I enjoy, I'm very blessed at the office that we have patients. I love our patients are amazing. They really, people say that, but we really have a base and just a group of patients that are so into taking care of themselves and love coming to get adjusted. It's just, it is a blessing to go there every day.
Yeah. Us too. I feel really lucky where we are as well. We're only about 2.5 hours apart here. You're in north of Atlanta. I'm in Birmingham, Alabama. So we should definitely be getting together more. So
no doubt.
What would you say some of your favorite studies are, whether you've conducted them or others that you like to rely on in your practice or reading over to keep yourself, focused?
That's an easy question because most of them are tattooed on me. I have them. Is anything related to how alignment is detrimental to nerve function? So basically things that are the pillar for us going forward. And most of the papers, with the exception of Dr. Deet Harrison's, I'd have to go with Dr. Don Harrison's papers on the ideal spine model. So they give us the model in which to reference normal range.
Mm-hmm.
After those, then I'd go with the Journal of Neurosurgery Spine has a lot on just abnormal alignment, tethering the cord, putting pressure, causing osteoarthritis, and anything from that. Those are like the main trunk of that I rely on. And then of course the cervical spinal cord study I was just talking about, anything like that, and all the branches off of those studies show abnormal lung function, people getting out of the hospital faster. In, I believe it was 1998, there's a journal of osteopathic medicine showed that people got basically thoracic spine adjustments, got out of the hospital faster, had pneumonia.
Wow.
Stuff like that. Anything like
really
that.
Important right now, when you say lung function.
That's, again, it just, piggybacking what's needed right now. So I've been talking about those forever. We have the Telomere Study. We put that out. That was the first one. I love that. Anything we've done that published is usually like a first. So if telomeres, diabetes, Dr. Evan Katz and his wife, they were nice enough to let us buy our way onto a paper they did in the Journal of Neurosurgery, showing that when the cervical spine is in alignment, there's an increase of blood flow like 200%.
Wow.
We have it on, have you ever seen that paper?
No.
Oh, really?
That's awesome.
You're in for a treat. I'm going to send it to you after we're done with this.
Oh, sweet.
When you see the images, you're going to be like,
nice.
Yeah, it's awesome. Like instantaneous, 15 minutes apart. Shows the blood flow, just the vessels expand huge. And with Alzheimer's being on the rise.
Oh, yeah.
We need like an Alzheimer's.
And all that, neurodegenerative disorders.
Correct.
What about the telomeres? You were I have that study printed up like literally right over there on that wall, but just for our viewers, listeners, can you quickly summarize that one?
Oh, in a nutshell, well, here's the thing. Just that took a lot. We had to contact a company and ask them how reliable their tests are.
Right.
We didn't want junk, either or. We didn't want exaggerated good results. We didn't want bad results.
Right.
So they said, no, our test is very reliable. It took us a few companies would finally actually give us the data. They're kind of like, who are you? We're like, we're researchers. We want to know. Companies love me for this, by the way. I won't mention any names. We call a lot of companies out when their product, if it doesn't work, I call them. This doesn't work. Like this is broken. So anyways, they this company said, yeah, there's about a 3% error in the retest. But I go, what's significant results? So like 8%. I'm like, okay. So we took 2 people and they live in the same household, and we told them, don't alter your diet. And we did their telomere length. And then 9 months later, we redid it. And interesting enough is that the young lady whose telomeres increased, I believe, is like 9 to 10%, which is an indication of like if you're getting younger type of thing. You have to look up telomeres. They're kind of like, the analogy you use is they're like the ends of the shoelace, the little device that holds the shoelace together. And those start to unravel, that shows that you're aging disproportionately higher to what you really are. But interesting is that her spine got better, her heart rate variability got better, which is an important measure of health for patients who want to know that. But what happened is the other lady, her neck didn't change, and she was actually like vegetarian, and her telomeres shrunk a little. And so, but the other thing is the lady who got higher telomere length, she drank 5 and continues to this day. She drank 5 Mountain Dews a day.
Ooh.
Yeah. Because people, when that came out, of course, they're, oh my gosh, who cares? She changed her diet. Could have been anything. Could have been anything. Right. We're like, she kept her diet. They're like, whatever. This, there's detractors of it. I'm like, look, she continued to drink 5 sodas a day.
So was this specific upper neck adjustment that you relate to?
No, the whole thing. She had forward head posture. She had loss of curve, bad heart rate variability score, which is high stress.
Yeah.
And so, but the changes were neck and heart rate variability improved. And then, so what I did is what any good American would do is I sold the results to Mountain Dew and bought a helicopter. First, I'm waiting for the check yet. So yeah. So I forget the chiropractic profession. I just sold the study to Mountain Dew.
Wow. But like to be clear, that the telomere length is indicative of how
healthy your
DNA and
your cells are copying themselves. So if you make a photocopy of a photocopy of a photocopy, you're losing clarity over time. And this is now that your telomeres are longer, it shows that you're actually making better copies, or anti-aging, if you will. Another study,
vitality and length of life.
Correct. Another study that piggybacks that is Dr. Chris Kent. They did a study on serum thiol. This is years ago, probably 10, 15 years ago. And I published this with a paper on a lady who I got out of a wheelchair, had muscular dystrophy. I was trying to figure out like how this would work. And it shows that your serum thiol levels after 18 months actually go up higher proportionally to people who have the same lifestyle, like a healthy lifestyle. And so I even tell patients that on their 18th month, hey, congratulations, you should be getting younger by now. Study, right?
Yep.
And I tell them the story, and I show it here. It is published. And so that is my thought, is that somehow this mechanism, as serum thiol goes up, that so does your telomeres. Again, it's all, it's just my theory on that. I'm sure some university is going to do a 1,000-person study on this, right, to prove me right.
Yeah, they're waiting in line. But
yeah,
I mean, this is something I've referenced this study, the thiol study, in a couple different episodes of our podcast last year. So
oh wow,
that's an awesome one, and I love it. And I always talk about that, and people kind of glaze over when I start talking about it. But I just basically summarize it. Look, healthy, healthier.
Pretty much, yeah. You're actually, you know what I say? I drew a picture of it. I say a cog in the wheel. I ask people, like, depends on their age. I'm like, you ever turn the wheel and there's like a clunk, like it's missing a sprocket? They're like, yeah. I'm like, right. So that's kind of like, this is filling in the gap so it runs smooth again. And they're like, oh,
Makes sense.
Yeah, anything I can do to make them understand is kind of what what we do. So
yeah, that's awesome. I love it. What do you think the most crucial things right now to tell your patients, according to the research you've conducted and over your experience, what would you tell people, the public, your patients, and, the general public, how they can be healthier and what they need to do?
And is basically this, is that you only have, if you have a laser, it has 100%, like you have a percent of use, right? So you have 100 laser beams, I guess you could say. You can't create 110. So if you are out of alignment, if your posture is off, if your body is using more laser, more energy just to hold yourself upright, and the big word, you love this word, I'm sure, tensegrity. If your tensegrity structure is off, you're using more energy just to hold yourself upright, which leaves less energy for other things like immune function. So my answer is my recommendation, like I do to my patients, is do whatever you can to keep your spine as healthy as possible, regardless of your symptoms. Because when you're more balanced, you have more energy to do stuff. When your spine is more in alignment, it works more efficiently. Your muscles don't have to pull as hard in order to move. When you're stiff, it takes more energy. And again, back to being a pro goalie. My kids aren't even here to make fun of me for that. It's that if you're into sports, as we age gracefully like wine, is that if your joints are stiff, you're going to slow down, right? So, and it takes more energy to do the same thing. So if you can maintain spinal alignment, that is a major key factor for health for the rest of your body. And then you have more time for like thought, immune system function. Oh, I forgot to tell you, we have a huge study coming out. We're going to release the results in October. You've heard of, well, I'll talk to you about it after, but basically it shows what is the biggest impact we have on patients. And what do you think it is? Do you think it's physical functioning or emotional well-being?
I'm saying emotional.
Yeah. On 14,000 people.
It's based on experience, but yeah, that's amazing.
Correct. Yeah. And that's great. And I love that, but we actually have it documented now.
Wow.
So when we cut out on this podcast, I'll tell you about it. You'll love to hear it.
All right. I can't wait. So I can share that in October?
Yes. Yeah.
I'm going to get so nerdy.
Yes.
Fall. Well, I see you in November.
Where's November?
In Florida. We'll be in Florida.
Oh yeah. You know what? What day is that?
November 4th to the 6th.
I speak for the ICA pediatric conference in Orlando. Everything's in Florida, right?
Yeah.
So yeah, probably. Yeah, I'll definitely head out there.
Excellent. That'll be great.
If Dr. Borio will give me some speaking time. I don't know if he thinks I have anything of value. I tried it. You can't please that guy.
There's always value. Look at this. I mean, we got a good 30 minutes, 40 minutes here of just gold. Any last words, any recommendations, stories, poems?
No, you know what? I'm just thankful. As I told you, my big thing, I'm just thankful that there's docs out there that are passing on the information that we're putting out so that the public knows it's available to them. That's what it's all about.
Yeah.
I had patients say if they would have known. How many times have you heard that in your practice?
Yeah.
If only I would have known. If
Somebody
only I would have
told me. Yeah.
Yeah.
Well, that's what we're doing now. So
correct.
Will you come back on in fall and talk about this new study?
Oh man, I got lots of stuff. I mean, I have 43, shameless plug. I have 43 published papers.
Wow.
So we can talk about whatever,
I have one.
Awesome.
I'll take the next 40 years to catch up.
Yeah, no. Well, great job.
Dr. Curtis, thank you so much. I really appreciate you. I wish you all the best, good health.
Thank you.
And I will talk to you again very soon.
Cool. Thanks so much.